it is really stressful trying to find a place. I've been looking for like the last like 2 weeks, and there's like nothing affordable in my area, as well as, well, I applied at like one place and they didn't contact me. So the thing is, it's because I haven't like worked for a while. I don't really have like, all I put like for work is disability, and because I'm renting a room, I don't pay the landlord directly, so I don't have like a reference from the landlord saying like, hey, this dude pays this rent on time. So it makes it more difficult for me. I'm getting kind of stressed out since it's the middle of the month, but I'm going to, I guess, look a little bit out of my price range by like $25, because that's the lowest. The cheapest rent is like $25 out of reach, because like for the past like 5 or 6 months it's been holding steady at about $500, $550 for like the apartment complex at Seafen. But now it's like $575, and I only get $906 a month, and $575 is a lot to pay for just rent without utilities. Sorry, someone's leaving outside. So I'm kind of panicking a little bit. On top of that, I have surgery coming in the beginning of June 3rd. And I don't want to like have to move in the middle of next month, or in the beginning of June even. That would just be terrible. That's like 3 days before my surgery. I don't want to be settling in. How am I going to get unpacked and stuff if I'm like having surgery? Not to mention, I'm trans and short, and I have a like I wonder like if people can tell that I'm trans, because where I am, that's not like there's basically a lot of bigots here, and I've been like looking for work for the past like 3 years here and haven't found anything. And I apply for work, I just don't get any callbacks because they're all terrible, and it'll be a lot better when I have chest surgery. But I'm really stressed because on top of trying to find a place and having surgery coming up, I'm also dealing with an abusive household, and there's like, this is a 4-bedroom house with 1 bathroom, and there's, let's see, at least 6 people like living here right now, plus the number fluctuates to up to 10 people being in the house at once. And it is very stressful. I'm also trying to get my 2 classes done because their deadline is like approaching quickly, and I need to get it finished before I'm like, well, I have to get a lot of it done before I like have surgery, because I'm gonna be, and my deadline's supposed to be in May, but I asked for an extension, and because I have ADHD, I'm allowed to ask for time. I just don't know how much they're gonna give me. Oh, on top of being ADHD and having severe social anxiety and depression and stuff. So this is a very, like, very difficult situation right now, and I'm kind of having a hard time dealing with everything going on at the moment. I'm having a really hard time focusing because I don't take medication, because I've had problems with taking medication in the past. Besides that, I'm about to have like a really important moment in my life, chest surgery, and I've been wanting this since I I went through puberty, basically. I am having, like, weird fears, though, and, like, weird concerns, and almost like I'm mourning a loss, even though I hate my chest. Sorry. I was getting dry mouth. But, just a sec. Sorry about that. I had to pause there. Anyways, I've been having, like, some concerns, like, how am I gonna feel afterwards? How, will I be okay with any, like, imperfections that might happen? How is it gonna, how is the skin gonna feel? Am I gonna, like, be annoyed with the sensations in my chest? Because I had, like, a mastoidectomy, you can, like, see the scar there. And ever since then, like, this ear, it feels different. It doesn't feel like my good ear anymore. So, and it bothers me, like, I'm constantly aware of, like, that ear because of the surgeries that I had on it, because they cut the nerves. And I'm worried that I'll get, like, weird, like, tingling or, like, strange sensations that will, like, bother me, because I'm hyper aware of that. I'm also worried that it'll make me feel more dysphoric, because I won't have a chest anymore, but I don't take hormones. So, and I'm kind of, like, I have really, like, thick muscular legs, and I worry that my shape will be still feminine even after chest surgery, and it's just gonna make my dysphoria worse, and there's, like, no way I can, like, fix that. I worry about not being attractive anymore, even though I feel like it would make me more attractive, but I don't know why I still worry. I worry, like, I don't know, that I'll be less attractive, because I don't know, testosterone wasn't really good for me. I didn't get a lot of good changes from it like a lot of guys do. My genetics are not something that I find to be optimal for me. As well as I had hypercalcemia, and my red blood cell count was really high, and I had high cholesterol, and I was not doing really well, and then I started losing my hair, and I wasn't getting facial hair fast enough, and I was gaining a lot of weight, and I was just not happy at all with the changes. So I feel like if I have chest surgery and I'm not satisfied, I feel like I'm, like, stuck in between a rock and a hard place, basically, because how am I gonna rid myself of this dysphoria? I feel like I'm not going to achieve like my ideal, like what I ideally want in, like, my physical appearance. Anyways, I am excited, but I guess they're just, like, normal fears. I mean, it's a huge surgery and it's a big change, because I mean, I've had to put up with them since I was, like, 12. Oh yeah, and I, like, in between this half and another half that I filmed, I got an email from my teacher, and they're extending my class until the end of the summer, which really helps, because I still have to read Macbeth and analyze it, and I'm still working on Lord of the Flies, so it'd be good to have, like, a bit of time. I've talked on, and I'm sure that I had other things that I wanted to talk about, but I'm just gonna cut it off here. I'm talking too much. I'll probably do another video, like, before I have surgery, and then afterwards, of course. Everyone films their, like, it seems like everyone films their surgery adventures, so. Anyways, if you made it through this video, I'm impressed. Thank you.